So imagine you are an engineer, right? And you are tasked with evaluating the structural integrity of a specific material.
Right, you need to test its limits.
Exactly. You
Oh.
need to know exactly how much friction it can withstand before it tears.
And obviously, if this material is thick, flexible, and deeply hydrated, a rigid metal tool sliding against it isn't going to cause any damage at all.
No, not at all. I mean, the material just compresses, it absorbs that pressure, and then it bounces right back to its original shape.
Because the underlying physical properties of that material are giving it, a really high tensile strength and elasticity.
Yeah, and this is where we get into the core of it. What if you take that exact same material, drain all the moisture out of it, thin it down to just a fraction of its original size, and completely strip away its underlying support scaffolding?
Well, the physical environment has just fundamentally failed under stress at that point.
Right. Now, when you apply that same metal tool, the material doesn't compress. It rips. I mean, it literally cracks.
It's a completely different mechanical reaction.
It really is. So welcome to the deep dive. Today we are talking about women's intimate health, and we are looking directly at the physical structural changes that occur during menopause.
Specifically, how those changes complicate a routine yet absolutely essential medical procedure.
Yeah, the speculum exam.
hmm
And here is where it gets really interesting, you guys. Imagine the blueprints to fix that failing, tearing material come from the most unlikely place imaginable.
And we really mean unlikely.
Yeah, we're talking about the DNA of a salmon.
Which means we are moving way, way beyond simple symptom management today. We're stepping firmly into the realm of actual cellular regeneration.
We really are.
Hmm.
So to understand how fish DNA could possibly help you or, someone you love in a gynecologist's office, we've pulled together a fantastic stack of sources.
We have a really comprehensive explainer from Harvard Health to start us off.
Right. And we've also got clinical FAQs and insights from the Women's Health Clinic, plus several real-world clinical studies and journal articles.
Including some deeply compelling data from OA Text and PubMed, all focusing on this novel regenerative therapy.
And I have to say, the contrast between the dry clinical data in these journals and the raw, lived experience of the patients highlighted in the clinic notes, it really underscores why this conversation is so necessary.
It absolutely does.
Which brings us to the specific mission for this deep dive. We are investigating a highly specific, highly practical question today.
Can polynucleotides improve local tissue tolerance and prevent mucosal tearing during routine speculum examinations?
Okay, let's unpack this. Because before we can figure out how a regenerative therapy stops mucosal tearing, we have to understand why the tissue is ripping in the first place.
And that requires us to look at a major shift in medical terminology that was highlighted by Harvard Health.
Right, this is super important.
Yeah, for decades, the medical community referred to this condition simply as vaginal atrophy. But today, the updated, far more accurate term is the genitourinary syndrome of menopause, or GSM.
And I noticed Harvard Health explicitly points out this isn't just like some marketing rebrand to make the condition sound more palatable.
Oh, far from it. The name change reflects the reality of a much broader, multi-system, really progressive condition.
Because it's not just one isolated symptom.
Exactly. Dr. Lisa Boot, who is a menopause expert cited in the Harvard piece, notes that GSM symptoms likely affect up to 85% of women in midlife and beyond.
Wait, 85%? That is massive.
A staggering number. And unlike hot flashes, which, might eventually fade away as the body adjusts over time, GSM actually accelerates.
It gets worse.
Right. Without intervention, the tissue degradation generally just continues to decline over time.
So when we say degradation, what are we actually seeing under a microscope here? I mean, I know estrogen is the main player, but how does its absence translate to physical tearing?
Well, estrogen acts as the master regulator for the tissues in the urogenital tract.
Okay, so it's running the show.
Basically, yeah. It maintains normal blood flow, it keeps the walls thick, and it ensures high elasticity. So when estrogen levels plummet during menopause, the architecture of the vaginal epithelium just collapses.
Wow.
It flattens out entirely. It loses its papillae, which are these tiny, microscopic, finger-like projections that actually help anchor the different tissue layers together.
And then the surface cells start doing something called keratinization, right?
Yes, exactly.
Because my understanding of keratin is from, like, hair and nails. It makes things hard. So the vaginal tissue is literally hardening.
It becomes significantly harder, rougher, and much less permeable. And simultaneously, deeper down in the lamina propria, which is the connective tissue layer, The natural collagen and elastin fibers become completely depleted.
So the underlying support is gone.
Yeah, they literally fuse together and fragment.
It's like the structural scaffolding is just rusting away.
That's a great way to put it. And the environment surrounding that scaffolding becomes incredibly hostile.
Hostile how?
Well, a healthy estrogen-rich vagina is heavily populated by lactobacilli. These are beneficial bacteria that continuously pump out lactic acid.
Right. Keeping the environment beautifully acidic, right around a pH of 4.0 to 4.5.
Exactly, which acts as a natural defense system, keeping the bad bacteria out.
But when the estrogen drops,
The lactobacilli basically starve, and the intravaginal pH shoots way up.
leaving the tissue incredibly vulnerable to irritation, microabrasions, and chronic infection.
Yes. So if we go back to that engineering metaphor you started with.
Right. The healthy vaginal mucosa is like a thick, plush sponge. It absorbs friction, it's resilient, it has give to it.
And the atrophied mucosa suffering from GSM is like dry, fragile tissue paper.
It tears under the absolute slightest pressure.
And the Harvard Health and OA Tech sources explicitly confirm this. This dramatic thinning makes the tissue incredibly susceptible to microtrauma.
Even from just regular, gentle contact.
Yeah, even incredibly gentle mechanical stress results in bleeding, ulceration, and petechia.
Petechiae.
Yeah.
Okay, those are the tiny pinpoint blood spots, right? Where the capillaries have just ruptured right under the surface.
Exactly. They are the literal physical evidence that the tissue's structural integrity has completely failed.
Which makes the speculum dilemma so brutally clear. I mean, you take an environment that has lost all of its natural cushioning, turned into fragile tissue paper, and you introduce a rigid metal or plastic instrument.
It's a recipe for injury.
It really is. Now that we understand the microscopic changes, it is so easy to see why a routine trip to the gynecologist turns into an absolute source of dread for so many of you listening out there.
And data from the Women's Health Clinic really emphasizes the severity of this. Inserting a standard speculum into atrophic tissue frequently causes direct trauma and spotting.
Yeah, they make a really fascinating point about clinical technique here, actually.
Oh, about the sizing.
Right. They argue that using a smaller speculum and performing a slower, explicitly gentle exam isn't some, luxury spa treatment for the patient. It is a clinical necessity.
Absolutely.
Because if you don't do that, the health assessment just turns into a painful, injurious experience.
And comfort and diagnostic value are deeply linked here.
Yeah.
You really cannot get an accurate diagnostic read or a reliable pap smear if the patient is in severe pain.
Right. Her pelvic floor muscles are naturally just going to seize up.
Exactly. And the tissue is bleeding just from the plastic touching it. It compromises the whole exam.
So for decades, the traditional first-line treatments for this have been, over-the-counter lubricants, long-acting moisturizers, or localized low-dose estrogen creams and tablets.
And to be clear, local estrogen remains the gold standard for many patients.
It replaces the missing hormone directly at the tissue level.
Right, essentially telling the body to rebuild the sponge we talked about.
But there is a massive catch. Some women absolutely cannot take hormones.
That's the real hurdle.
We're talking about breast cancer survivors undergoing certain treatments, for instance, who have absolute contraindications to estrogen.
Their bodies just can't have it safely?
Exactly. And for them, simple over-the-counter lubricants are just a temporary slip-and-slide layer. They do absolutely nothing to stop the underlying tissue paper from actually tearing.
They need a way to rebuild the scaffolding without triggering any hormonal pathways whatsoever.
And this is where emerging non-hormonal regenerative therapies enter the picture. Specifically, treatments utilizing polynucleotides, or PNs.
This is such an exciting area of research right now.
Okay, this is the part of the deep dive that actually had me rereading the sources 3 times.
The origin of the PNs.
Yes, the data from Serenity Women's Clinic and the OA Tech's journals states that these polynucleotides, these highly purified DNA fragments used to regenerate human tissue, are extracted from the sperm cells of salmon or trout.
I know it sounds like science fiction, but what's really fascinating here is how remarkably compatible marine DNA is with human tissue.
Okay, I have to stop you there, though. I understand that we are putting fish DNA into human tissue, but doesn't the human immune system just, immediately flag that and attack it?
You would think so, right?
Yeah. How does it not trigger a massive immune response?
It all comes down to extreme, rigorous purification.
Okay.
The manufacturing process subjects this marine DNA to intense sterilization, completely stripping away all the proteins and peptides.
And why is that important?
Because proteins are the specific molecules that normally trigger an immune response or an allergic reaction.
Hmm.
Once those are entirely gone, you are left with just the pure, fundamental building blocks of life.
Wow. So the body doesn't see fish, it just sees raw construction materials.
Exactly. These marine polynucleotides act as a powerful biostimulator when introduced into human tissue. They don't just coat the tissue like a moisturizer, they fundamentally interact with the human cells.
So walk me through how this actually works, like mechanistically.
Yeah.
How does purified salmon DNA stop a metal speculum from ripping the vaginal wall?
Okay, let's zoom into the cellular level.
Right.
When these polynucleotides are applied to the tissue, and the sources note, they can be delivered via daily vaginal ovules, creams, or even intradermal injections in a clinic setting. They are enzymatically cleaved.
Wait, cleaved, meaning broken down.
Yeah, broken down into smaller pieces by the body's natural enzymes, and as they break down, they progressively release small nitrogen precursors.
What kind of precursors?
We're talking about nucleosides, nucleotides, and nitrogen bases.
Wait, nitrogen bases, are we talking about the literal letters of DNA here? The A, C, T, and Gs?
Exactly those. Adenine, cytosine, thymine, and guanine.
That is wild.
It is. And these tiny fragments act as a direct signal to the fibroblasts residing in that estrogen-depleted mucosa.
Okay, remind me, the fibroblasts are the actual builders in the tissue, right?
Yes, they are the cellular factories responsible for churning out new collagen, specifically the strong type 1 and 3, as well as elastin and extracellular matrix proteins.
But in an atrophic vagina, these fibroblasts have essentially gone dormant.
Right, because the site manager estrogen left the building.
Ah, so the construction crew just went to sleep on the job. And then the polynucleotides come in, bypass missing manager entirely, hand the crew a brand new set of blueprints and a massive pile of raw materials, and just tell them to start rebuilding the structural scaffolding immediately.
That's a brilliant way to look at it. And to refine that analogy just a bit, the polynucleotides also physically change the workspace itself.
What do you mean?
Well, as they break down, these hydrophilic or water-loving polymers reorganize into a three-dimensional gel inside the tissue.
Oh, so they are actively pulling water in.
Massive amounts of water. In fact, formulations often combine them with hyaluronic acid, or HA, which aggressively compounds this deep tissue hydration.
So it's not just making the tissue wet on the surface like a lube. It's almost like dropping a million microscopic orbes into the deeper layers of the tissue.
Yes.
They absorb the water, swell up, and physically push the tissue walls outward.
That visual captures the mechanism perfectly. And the Women's Health Clinic sources describe the end result of this exact process as creating submucosal cushioning.
Submucosal cushioning. Okay, that is the exact opposite of tissue paper.
Exactly. By regenerating the collagen and elastin and deeply hydrating the tissue from within using that Orbeez effect, you recreate the plush sponge.
And that cushioning mechanically reduces the friction trauma that occurs during a speculum exam.
Right, or during intercourse. It provides a physical, robust buffer against mechanical stress.
Okay, the theory is incredibly elegant. Wake up the fibroblasts, drop the Orbeez, build submucosal cushioning.
It makes sense biologically.
It does. But does the clinical data prove that this tissue regeneration actually stops the tearing? Like, if a listener is dreading their next pelvic exam, does this translate to real-world relief for them?
Well, the real-world clinical studies actually provide highly compelling evidence for this.
Let's hear the numbers.
So there's a prospective study published in OATEX by Alessandri and colleagues. It involved 54 postmenopausal women suffering from severe vulvovaginal atrophy.
Okay, a solid sample size.
Yeah, and they used a PN-based vaginal ovule, which is basically a solid medication that dissolves internally once a day for 2 to 4 weeks.
2 to 4 weeks. That's a relatively short window. Let's look at the Vaginal Health Index, or VHI, that the researchers used to assess the tissue before and after treatment.
Right. The VHI measures a lot of things: elasticity, fluid secretion, pH, mucosal integrity, and moisture.
But to answer the core question for this deep dive, we really need to focus on the physical tearing.
Yes, and the most relevant metric for that is the assessment of epithelial petechia, those pinpoint blood spots we mentioned earlier.
The physical evidence of the microtearing.
Exactly. And in just 2 to 4 weeks, they observed a massive 51.6% improvement in superficial petechia scores.
Wait, over 50% improvement in under a month?
51.6% to be exact.
That is incredible. That means the tissue was significantly less likely to bleed when a clinician even touched it.
Yep. And deeper tissue elasticity also improved by 50.9%, and overall vaginal hydration improved by nearly 60%.
Wow.
So the ovules clearly proved the concept. But the scientists had a separate question. What if we deliver these blueprints straight into the deeper dermal layers using a needle?
Oh, bypassing the surface absorption entirely to get straight to the dormant fibroblasts.
Exactly. And that led researchers Palmieri and Ricci to test a sequential injectable protocol.
Okay, injecting it directly.
Yeah, they injected polynucleotides combined with hyaluronic acid directly into the vulvovaginal tissue. And by day 90 of their protocol, the patient's symptom scores for soreness and tingling dropped by 70.1%.
70% drop in soreness. That's huge. And the dyspareunia stat from that study really caught my eye, too.
It's a critical one.
Because dyspareunia is severe pain during sexual intercourse.
Yeah.
And it dropped by 59.4%.
And it is a crucial metric for our discussion because pain during intercourse mimics the exact kind of mechanical friction and stretching that a speculum causes.
Right, it's that same mechanical stress.
Exactly. So if dyspareunia is cut by roughly 60%, the local tissue tolerance for any medical instrument is going to be vastly improved.
Because the structural integrity is genuinely returning. Plus, the environmental factors being addressed too, right?
Yes.
Because the OATEX study noted that the vaginal ovules also contain lactic acid.
Right, which helps restore that intravaginal pH back down to its normal acidic range of 4.0 to 4.5.
And as we established, a healthy acidic environment wards off pathogenic bacteria and chronic inflammation,
Providing this really vital secondary layer of protection against tissue trauma.
So if we step back to answer our main question for today, the data strongly suggests that increasing mucosal thickness, restoring elasticity, and rebuilding that submucosal cushioning with polynucleotides.
It significantly improves local tissue tolerance against mechanical stress.
It actually repairs the structural integrity from the inside out.
It really does.
Okay, but before we crown fish DNA the ultimate miracle cure, we definitely need a reality check.
Always a good idea.
We need to ground this in the actual doctor's office. Are clinicians just throwing out their estrogen pads? Is this completely replacing hormone therapy tomorrow?
No, definitely not. And the Women's Health Clinic FAQ in our sources provides a very necessary boundary on this.
What do they say?
Well, they emphasize that while the biological mechanism is incredibly sound, and these pilot studies are incredibly promising, the robust long-term clinical evidence for polynucleotides in intimate health is still growing.
Okay, so it is an emerging therapy. We aren't looking at a decades-old established standard of care just yet.
Right. It should be presented to patients exactly like that, as an emerging regenerative treatment. It is not currently a proven one-to-one replacement for vaginal estrogen.
Which firmly remains the gold standard for treating GSM in women who can safely use it.
Exactly.
And let's talk about the reality of getting this treatment too. Because ovules and creams seem simple enough, non-invasive, you just use them at home.
Very straightforward.
But intradermal injections in an area already suffering from severe thinning and pain, that sounds incredibly daunting.
The clinical biorevitalization protocols are intense. There's no way around it. The sources mention these injections absolutely require a topical lidocaine cream beforehand.
Numbing is a must.
For sure. And even with local anesthetics, it's not entirely without side effects.
Yeah, the data indicates around 40% of women experience mild, temporary side effects at the injection site.
Like mild swelling, localized burning, or itching.
Which, while those reactions typically resolve spontaneously within a few hours or days, we cannot ignore that it is a physical intervention in a highly, highly sensitive area.
It's a serious consideration for any patient.
And this brings up a massive question about patient navigation. If estrogen is the gold standard, but PNs are this exciting new tissue builder with kind of an intense delivery method, who actually gets this treatment right now?
Well, this raises an important question, right? And the true value of polynucleotide therapy right now is for the patient who has simply run out of options.
Like we mentioned earlier.
Right. The breast cancer survivor who cannot risk an ounce of estrogen, or the woman suffering from severe localized side effects from hormonal contraceptives.
Because being told your only option is a drugstore lubricant that isn't working, that is a devastating clinical dead end.
It is. So finding alternatives for those with absolute contraindications is vital. Polynucleotides offer a biologically active structural treatment that relies entirely on cellular regeneration rather than a one-size-fits-all hormone fix.
It gives them a tangible, scientifically grounded option where they didn't have one before.
Exactly.
Okay, let's pull all these threads together. We started by examining the genitourinary syndrome of menopause, or GSM.
Which causes severe tissue thinning, a complete loss of elasticity, and a rising pH.
Right, turning that resilient vaginal sponge into fragile tissue paper. And that makes routine speculum exams incredibly painful and physically traumatic.
We then explored how highly purified marine DNA fragments, the polynucleotides, offer a really novel non-hormonal intervention.
By undergoing enzymatic cleavage, they release those nitrogen bases that basically wake up the dormant fibroblasts.
The construction crew gets back to work.
Exactly. They rebuild collagen and elastin, they drop those microscopic Orbis to bind water into a 3D gel, and they recreate that essential submucosal cushioning.
And the clinical evidence tracking the vaginal health index shows massive reductions in petechiae and tearing, vastly improving tissue tolerance against friction.
All while maintaining the very realistic perspective that this is an emerging, specialized science.
A very necessary caveat.
So what does this actually mean for you, the listener? Whether you are personally managing menopause, navigating post-cancer care, or simply advocating for a partner, a mother, or a friend.
Knowing that structural non-hormonal tissue regeneration is possible gives you immense power in the doctor's office.
It really does. You do not have to just grit your teeth and put up with painful exams. You can advocate for yourself, you can ask for a smaller speculum, you can demand gentleness, and you can inquire about regenerative therapies that rebuild your tissue's actual tolerance.
And if we connect this to the bigger picture, it leaves us with a truly fascinating thought to mull over.
Oh, definitely.
Because if we can successfully use marine DNA to reverse the structural aging and fragility of the vaginal mucosa,
Effectively teaching old dormant cells to rebuild lost scaffolding.
right? What does this mean for the future of treating other friction-prone atrophic tissues in the aging human body?
That is such a good question.
Could this exact same mechanism be used to rebuild the cushioning in our aging joints? Or regenerate thinning vocal cords? Or even repair micro tears in our cardiovascular system?
It is incredible to think about. The exact same engineering principles of material strength and repair apply whether we are talking about a steel bridge or the mucosal lining of the human body.
The biology is universal.
The material doesn't have to inevitably fail under stress. Sometimes it just needs the right blueprints to rebuild itself. Thank you so much for joining us on this deep dive.
It's been an absolute pleasure. Keep questioning and keep exploring.